So what we want to do is, depending on the blood supply, we want to cut a bit of bowel here, and we cut it here, okay? So we remove all this bit here, okay? We cut that and we send that off to the lab. What we do with this part, as I was explaining to Mr. Mitchell, is we can do one of two things. If things look clean and healthy, we'll attach this bit to that bit, and it just continues. Yeah, makes sense? Because there's a gap now, isn't there? But what some of these patients have is we can't attach them, because if we attach them together with sutures, the environment isn't good for healing, especially if there's a lot of poo around or things stopping healing. So what we do then is we give the bowel a rest. So we divert the poo, we take this part and we attach it outside the skin. So we bring it forwards onto the skin and we put a bag there. So the food goes down here to the stomach, duodenum, small intestine, out into a pouch which we attach here. This part we close off. We allow things to heal and get better, and then we open him up again and we attach the ends together. Now the next stage of treatment for him would be a surgical procedure to remove the cancer. We need an anaesthetist to put the patient to sleep, and that's to provide pain relief. Sleep. Quick, this patient's vomiting. Yes, that way, do you want to come up as well? Okay, Dan, you want to come up as well? Dan, you're the nurse, you're the first person to see this patient. What are you going to say to him?
Are you okay?
Yeah, go on.
Are you okay? No, I'm being sick. I remember. There's a pain in my stomach.
Okay, Dan, do you want to deal with him? Or do you want to call a doctor? When did it start?
About half an hour ago.
Okay, and has anything brought it on?
No, I haven't eaten anything.
Yeah, is there anything important that we should know that's happening at the moment?
I've been tested, they think I might have bowel cancer.
Okay, and how far have you got on those investigations?
I'm still waiting on the results to come back. They've done the camera on the blood.
Okay, that's great. Okay, what we're going to need to take from you is take some blood samples. Okay, it's enough to the laboratory, and also to take a picture of your tummy as well to see if there's anything happening there. Okay. It's not normal at all. This is small intestine. Small intestine is not that big. Okay? So what's happening is this cancer, which is down there in his ascending colon, is obstructing the flow of food, air and water. So what happens to a balloon if you blow in it and there's nothing coming out the other end? It gets bigger, gets bigger, gets bigger. So if he eats any food, is it able to go down? So what happens? He vomits. Makes sense, yeah? So we need to ask permission from him first.
Can I take some blood?
Okay. Now, we're not actually going to take blood from Jonathan. We're actually going to use the doll. Okay. Okay, so do you want to pop that around his arm because we need the veins to pop up. Pop it in. Tighten it up. It doesn't matter. That's fine. That's fine. Okay, you need to clean the area where you're going to take the blood from. Yeah, that arm.
Oh.
No, it's big arm. That's where we're taking the blood. Okay. Okay, can you see a vein? Or can you feel a vein? Yeah, it's a big clue. Okay, we're going to isolate this vein. Okay, then we're going to take blood from it. Do you want to go? You won't hurt it, it's just made out of foam. So what you want to do is just go between my fingers there. Okay, you don't hold it like that. You don't hold it like that, okay? Okay, yeah, like that, okay. Just pop it into the vein, okay. Okay, push hard. That's it. Okay, you want to pull back? Pull back, just on the plunger. There we go. We're going to have to go in today and perform an emergency operation to relieve your symptoms and take the cancer away. For this, I'll give you the anaesthetist who will come and have a word with you. Okay? Okay, I'll come with you. First of all, you need to check it's the right patient. Okay, so we can put allergies there. Okay, have you ever had the general anaesthetic before? Okay, this is how it's going to work. We'll put a needle in the back of your hand, give you a milky liquid, you'll be asleep in about 5 seconds, and then we'll keep you breathing with some oxygen as well. We'll put in a tube in the back of your neck, which might be uncomfortable. Okay, there are risks involved with it. Have you had any family history of any problems? And he's completely fine. So the next stage to do is to actually put in one of the needles into the back of his arm. Okay? Do you want to have a go with that? Yeah. Okay. What you want to do is to feel the vein, okay, and just go into the angle and push it in. Don't push in too far, and you'll see some liquid coming out. When the liquid comes out, stop. I'll tell you what to do next. So hold it like that to begin with, and you can control it with the other hand as well. So find, I can feel where the vein is, be confident. Is it going in that direction, or is it going in that direction? So you want to go with the line, okay. Very good. Press in, keep pressing in. Get in any fluid back. Yeah, that's fine. Have you got fluid back? Okay, let's take it out. Okay, it's just a piece of plastic that stays in. The needle just introduces. Okay. That's fine. So that's gone in. Okay, and we close that up. Just pop it over him. He's gone to sleep. Okay. He's gone to sleep. Okay. The alcohol gel you can use there. We need to minimize the risk of infections in surgery, okay? And there. I'll show it to you. Yeah, you can do it once, it's a practice run. But you'd clean up to 8 times. Mind you're not touching anything. Okay, well done. Okay, put it down. And now the gown. Remember how I did that? I held it at the top and I let it drop. So pick it all up first, so the whole thing, and then away from everyone else, just let the bottom lip drop. Okay, now the trick is, yeah, you've got the right way, is to get your arms in first. So bring it over and get your arms in. And our helper who tied me up can do the same with their knees as well. Good. Another thing I don't like. Hold only the cardboard. Keep hold of it. Well done. Okay, don't start your gloving. It's not easy, is it? No. Okay, so you want to do the left one first and hold it against your arm and place it over, yeah? Make sure you're not touching anything else. Yep. You can use you can cheat a little if you need to. It's not easy the first time. Yeah, you can cheat a little bit. Yeah, that's great. Yep. Fantastic, well done.
Can I touch?
You can't touch it with that glove because that glove's completely sterile now. Okay, haven't touched anything else. And all this is sterile. I can touch you, but no one else is. Yeah, you can cheat again.